My name is Craig Lesser. I'm a vet and farrier at River Equine Hospital. Today we're going to apply a Sigafoos Series 1 with a pad. We're going to start by mixing up the glue until it's nice and homogeneous. And then go ahead and I start wiping it into our cuff. I like to start in the middle of the cuff and get the glue all the way down to the bottom to ensure that it can go all the way through. I then go to the outside, wiping upwards, ensuring that the entire cup is filled, and then the same thing on the inside. The glue itself actually just sticks to other glue. It doesn't stick to the cup directly. The cup acts more as a framework holding the shoe on, so it's important to have plenty of glue and to rub it in between the layers. As you can see with my shoe, I like to cut them my heel's pretty far forward, allowing us to have plenty of heel expansion. Once the cup is filled with glue, I go ahead and rub it into the wall to start the adhere process. Today we're using some medicated sole pack underneath the shoe. So I will remove that before applying the shoe. I rub the cuff up onto the wall, and then the excess I push forward to give us a nice clean finish. When wrapping, it's really important to hold the roll correctly. Your thumb needs to be towards the wrap and your elbow outwards. I start by holding with my other hand at the heel bolts and wrapping in at the toe to lock the shoe in place. 1 or 2 wraps there, and then I keep switching directions, back and forth. It's really important to grab 1/4 of the shoe, and then the foot afterwards to give us that leverage. When we're wrapping, this move right here, where we're grabbing that lateral branch to the medial heel, pulls the shoe inwards. This pulls the shoe outwards when we're grabbing the medial branch and the lateral heel. When we grab both heel bolts and the toe evenly, it pulls the shoe back. And when we grab the heels of the shoe and the dorsal wall, it pulls the shoe forward. Once I get about halfway through, I check. And if I need more plastic, I can add to it. Otherwise, I go ahead and put the foot down and rub downwards on the wall to give us a good finish. This should give it a nice shine and even distribution of the glue. You'll know the glue is set whether you have a little bit extra left in your cup. When you concuss the wall, it'll make a certain noise depending on your knife, or if the heat has come and gone in the foot itself. There's a few ways to cut the plastic off. The safest is a box blade, or you can use a razor blade. Just cutting away the plastic, and then the vet wrap itself, and then peeling the plastic off the wall. Then removing the rest of the protection. Once that's removed, you should have a nice finished product.